to another of our video snapshot series interviews. My name is Ruth Thomas-Squance, and I'm the co-executive director at Build Healthy Places Network. And we're a national centre fostering cross-sector collaboration across healthcare, public health, and the community development sectors to accelerate community-centred investments in racial equity. So like many institutions who are taking a holistic approach that addresses the non-medical drivers of a community's health, BHPN has been using something called the Vital Conditions Framework. And the vital conditions are properties of places and situations that all people need for health and well-being. The framework is clear and concise and built for concerted action. And we're really excited today to introduce our guest, Bobby Milstein, who is the Director of Systems Strategy at ReThink Health and the Rippel Foundation, who was part of the initiative that developed the framework. So he's going to tell us a little more about it. Welcome, Bobby.
Thank you. It's a delight to be with you and all the viewers here.
Great. So many public health practitioners as myself, and those that work to improve the health and well-being of communities, may be more familiar with social determinants of health as a model. How does the Vital Conditions Framework build on social determinants to help us create conditions where families can thrive?
It's a great question, and I'll say that I too am a card-carrying public health professional. I went to school of public health. I worked for 20 years at the Centers for Disease Control. I've worked with local public and local, state, federal agencies across the landscape of this. And I grew up in an era when there was a worldwide effort to, sort of get out the message that health is more than healthcare, and that was largely organized around the phrase social determinants of health. In practice, the agenda of what that was aspiring to do was to bring people from all walks of life and organizations in every sector, every industry, to recognize that health is a big thing that all of us shape. But in real experience, over time, there was a frustration behind that. It was very hard to organize multi-sector partnerships that brought everybody to this work, because frankly, not everybody is as moved to organize around anything that's called health, no matter how big we define it. And after, here we are talking in the early, 21st century, after years of a biomedical industry that has put into the public imagination that health is healthcare. And no matter how much of our research tells us that there's more to the story, we really haven't been able to organize around health as the unifying goal. And so we started to get a lot more practical. The Institute of Medicine in 1988 and again in 93 and other times have articulated that the purpose of public health is to assure conditions in which all people can be healthy. And frankly, for 30 years as a field, we haven't really come to much practical consensus about what those conditions are. And it was through ReThink Health and the kind of multi-sector partners that were coming together to really, out of love of people and place, to think about what each of them could do. We were trying to find tools and resources that would help them stay focused on creating the conditions that some people enjoy every day, but many have never had in place for them and their families. And we started to take that sort of ethos of what the social determinants agenda was trying to get at and render it, as you said at the top, in a form that was clear and concise and built for concerted action. And that ended up being like just plain spoken definitions of a group of vital conditions. We name them vital conditions. It's a little bit of a play on the vital signs that each of us, a doctor might look in our bodies. These are the vital conditions that we encounter in communities and in our lives together that have such immense influence on our potential to participate and prosper, reach our full potential.
Yeah, indeed. So, as a framework, the vital conditions, clearly broadens that scope and outside of clinical realm, and it brings in factors such as community infrastructure. So how do you envisage public health practitioners using this framework? So as they advance health and racial equity through upstream interventions and cross-sector collaborations?
Yeah, so that's a good question, and it's got a lot of pieces to it. One is to really simplify and sharpen the practical expression of what public health work has always been about, which is not changing people, but changing the world so it's built for people to reach their full potential, and not just like to sort of quote intervene upon the population, but to engage everybody in that population to help do their part to shape a world that matters. And of course, the contributions that each of us as individuals, families, through organizations that we touch, we have immense influence, if only over our own lives and the sphere of influence that we most touch. And so getting clear about what are the conditions that we most want to establish in the world, and being able to reckon where they are well established and where they aren't, or where they've been, let's say, disrupted or denied or disinvested. These questions come to the foreground when you're actually working with I'm going to use a little bit of a technical term, but this is like a normative list of things that we expect to see in the world, except we've never established them in the world, right? So it's really an act of creating a future where all people and places can thrive, and doing that by establishing vital conditions that all of us need, and frankly are not terribly controversial, right? Vast majorities of people across America and around the world will instantly agree that we all need clean air and clean water and humane housing and meaningful work and wealth. We labeled these with adjectives in front to characterize the kind of moral standard by which we're looking for. It's not just like some housing, dangerous, overcrowded, in segregated neighborhoods. We're talking about humane housing that any of us would consider dignified. And that's a different standard. So we've baked into the structure of the vital conditions an ability to actually be more humane and more practical, and then, and only then, to figure out what can I do in my organization or my field of practice, what can we bring to the party of establishing these vital conditions. But we shouldn't be debating as a society whether people need humane housing or whether belonging and civic muscle matters. There's no scientific uncertainty about those things. The big question is, can we, and for whom and where will we establish these vital conditions?
Yeah, I mean, it's a great point. And I think one of the strengths of the vital conditions framework is how accessible it is, and how accessible those factors are, and self-evident in their nature. So one striking element, when you've talked about addressing people and how they get involved, one striking element of the vital condition framework is that you centered it around belonging and civic muscle. So that's not something often associated with the idea of health, but perhaps you can share a little bit about why creating a sense of belonging and civic muscle is so foundational when we're trying to create thriving and equitable communities.
Yeah, it's a great point, and it was intentional. And frankly, this is a design decision that reflects centuries of insight from people who know what it means to be interdependent with other people, right? We are not living disconnected lives. We are unique people in a common world. We're all born connected to a parent, and then we have all kinds of ways in which we need to feel connected. And we also, even by early childhood and certainly through adolescence, we have a need to contribute. And so those things are really the mainspring of what health and well-being are. And it turns out that they have all kinds of like practical implications, right? So belonging, feeling a part of a community, embraced for who you are, valued for what you bring, these things are both life-giving, but they're also, if they're not in place, it's very toxic, right? Loneliness, isolation, alienation, exclusion, segregation, all the forms that break our sense of belonging, that we are not part of each other's lives and we're not connected to the world in which we live. Those things are deeply toxic. And the flip side is, if we might feel that we belong, but our belonging is never fully expressed until we can contribute, until we bring things that matter, and we create a world in which our full expression can, and our assets and our gifts can come into the mix. And the good news is that we are not the same people. We are very diverse in color and class and culture. And through that plurality, we have immense assets that are actually kept on the sidelines to maintain a society that is structured with lines that too often divide. And so this issue of belonging and civic muscle, I take it really personally, because the fact that it's kind of hasn't been as fully studied or emphasized in population health science is really a failing of population health science. It's not like we're just discovering as a people the importance of belonging and the things that we could do in our civic life that we can't do alone individually. So we put this at the center because it is a vital condition, without it, which, you know, our lives are deeply compromised. And it's also like a turbocharging capacity that allows us to make equitable progress in every other area, right? If we want to bring more people into the circle of human concern and be able to sort of pass policies that are designed to be more inclusive and equitable, we're going to have to do that intentionally to expand belonging and build the civic muscle that almost by definition we lack now, because we haven't been able to put into practice a large list of things that we know would be significant strides toward equitable health and well-being. So it's kind of got a special place, first among equals in all of the vital conditions.
Yeah, I love that. And that bi-directional flow between your interaction with the community and the environment, and how that feeds back on your health. And so I'll just add, you know, one other question is, it does feel like this extends towards how we center community in our process of addressing the vital conditions and the solutions that we bring, in sense of centering them as part of their belonging and their civic muscle engagement with influencing their own environment.
Yes, and I think it goes some distance toward taking the euphemism of community engagement and turning it into, you know, who's engaged in what, where, and for what were we trying to create. A lot of population health science for decades, and you know, I've been practitioner of this, a proponent of this, I guess I'd say, has been for a long time focused on the things we want to prevent, the things we want to stop and get rid of. And Lord knows there's all kinds of things that we can avert, but we could spend a lot more time talking about what we most want to create. And when we talk about wanting to create the experience of thriving, there are many contributors into that who would joyously say, here's what we can do to expand, let's say, our economy in ways that create meaningful work and wealth, that think about reimagining transportation systems and food systems. These are all things that end up coming into the mix when we get serious about creating a world that establishes vital conditions for everybody, leaves nobody out. And so now we could do the analysis of where are these established, and applaud those who've been able to get that job done, and frankly, prevent erosion from, you know, great gains of the past. None of this is a given. And we can concentrate on those places that have the furthest to gain, or those people who have the furthest to gain. This is, you know, for those that have studied investment priorities and equitable investment, I've learned this from BHPN and others, you know, it's really that concentrated effort on establishing universal goals for everybody. We can thrive. Everybody needs vital conditions, no exceptions, but there are plenty of exceptions. And so where do we focus on those who have the most to gain? And that is equitable investment by design, really concentrating on who's situated furthest and who's been systematically excluded. The folks at John Powell and the Othering and Belonging Institute call that targeted universalism. But in the framework of the vital conditions, we don't need, you know, 4-syllable words to get that out. We can talk about it instantly with people who know in their own neighborhoods who has these conditions in place, and where do we need to roll up our sleeves and make sure that experience is true for everyone.
That's a great note to end with. So thanks so much for your time today, Bobby. And we found the vital conditions framework extremely helpful, and I hope others do too.
Absolutely. We learn with every new person who comes to this what they see in it and what they think it inspires them to do. So it's just a joy to imagine doing this work on a larger scale with you and everyone listening.
Great. Thanks everybody for listening.